Testing for COVID-19 antibodies can give doctors some valuable information right now, and the FDA offered some guidance this week. The founder and CEO of Ms. Medicine, Dr. Lisa Larkin, is offering that test, and she's with us to talk about it. Dr. Larkin, good to see you. How are you doing?
Good. How are you?
I'm just great. So why did you decide to offer the COVID-19 rapid antibody test?
Well, right. As you know, that entirely during this pandemic, there's been a shortage of testing. Now, the testing that people need during an acute infection is the nasal swab for detection of the actual virus. Antibody testing is not the same, and what I'm offering in my practice is testing for the antibody. Antibodies are the body's response to an infection. And so detecting the presence of an antibody gives us information about whether or not the patient has had an infection and is resolving an infection. And so it can be helpful information, but it's very different than detecting the presence of the virus.
So why would it be helpful for your patients to know and for you as their doctor to know?
Right. So first of all, I want to say that not everybody needs to be tested. Now, where this can be very helpful, for example, is a patient who thinks that they had an infection several weeks ago and was not able to get testing. So as you probably know, we know that it's 25 or maybe it's higher, we're not really sure, of people have asymptomatic infections, meaning that they don't have any symptoms. And so we don't really know the number of patients that have been infected with no symptoms. Antibody testing would help identify them. But for patients who think that they've been sick 3 or 4 weeks ago, couldn't get testing, having a positive antibody test helps them know that they did have the infection, and now they have antibodies that confer some level of protection against getting infected again. And so when we're talking about social distancing, what we're worried about is people who are asymptomatic and shedding virus and infecting other people. If you've had a prior infection and you have antibodies, you know that you're really protected.
I want to cover one last thing with you, Dr. Larkin. This week, Dr. Amy Acton reported that social distancing is making a difference. Fewer people are getting sick. It is preventing coronavirus. But now you see people on social media saying, oh, it was all overblown, people just panicked. So what are the real facts?
So first of all, you've seen in the last couple days that the data has really changed from the modeling that shows that the number of deaths that we probably will have across the U.S. has come down. So the original estimates were 100 to 240,000. For the last several days, it was 100,000. It dropped to 80. Yesterday, it dropped to 60,000. I mean, I think we should be celebrating that. And really, frankly, I celebrate Dr. Acton and I celebrate Governor DeWine for really in Ohio initiating early stay-at-home policies, because that is the reason that we have had flattening of the curve. Social distancing in Ohio has worked very well. I mean, New York has been in a terrible state. The numbers have started to come down there as well because of social distancing. But I think we should really celebrate the efforts of social distancing and the profound positive impact that has had on this pandemic, not negate it, right? If we hadn't done it and the cases, instead of being 240,000 deaths, was 1 million, we would be kicking ourselves for not having been more aggressive. Now we should celebrate that social distancing really worked.
Lisa Larkin, MD, online. If you want to check her Facebook or Instagram, she's answering questions every day.